recording now. So
Oh, I can see.
I'll chop any bits out that we're not happy with.
All right then.
So, introduction.
Hello.
Hello. So we're going to talk about. I don't know. We're just going to talk, aren't we? But I think we're going to focus mainly on. We're going to talk about ladies' health.
Yes, very important.
Subject I'm very clued up on, obviously. I'll mainly be asking questions and listening today. So
It's very interesting, though.
Yeah, it is. Well, from what we've talked about previously, it definitely is. And it also kind of it's not just about being. It's not about pregnancies necessarily, is it? It can.
No,
The stuff we're going to talk about applies to fellas as well.
it really does.
Not the pregnancy stuff, obviously, but
No.
we've all got a pelvic floor. It's something we're going to talk about. We've all got core muscles.
We do.
We've all got the same muscles, and they all require the same things. So, do you want to make a start? How should we start?
Well, I suppose maybe I'll say why I got into doing pregnancy and postpartum like coaching, I suppose. So when I got pregnant the second time, I sort of like started to look into everything. So first pregnancy, the advice you had was either do nothing or carry on doing whatever it is that you did pre-pregnancy and you'll be fine. And that was it. They were the two extremes of like any advice out there. So for me back then, I did nothing. So I pretty much did nothing.
Were you training
my first
back
pregnancy?
Then?
No, not at all. So I did pretty much nothing through my first pregnancy. The odd swim here and there, maybe, and a few walks, but like nothing particularly mega.
What was your training prior to being pregnant first time though? What was your sort of exercise?
It was like if I wanted a tub of ice cream, I'd walk to Morrison's to get it.
Yeah. Okay.
That's kind of where I was first time round,
Yeah,
teenager. I was only like 20 when I got pregnant. So I was coming off the back of being young, youthful, and being able to get away with doing fuck all.
Yeah. So you weren't training?
No, not at all in that one.
Not
So
that you
like,
have to.
no. And then, and then when I started training after that pregnancy, I never considered anything to do with postpartum recovery. I just kind of cracked on. I did X, Y, and Z programs, like at home, whatever, just cracked on my own. Then I joined CrossFit, and then, and I just did it. And I never ever gave any consideration to anything. I never considered that any like back pain I had or anything, little issues had anything to do with my lack of recovery from my first pregnancy. And then all of my lack of core strength, something I've always really struggled with, like no matter how hard I work on it, I would always be like, why am I struggling with this? Like always, it was like, I just couldn't, I worked really hard at it, but I didn't really improve. Yeah. And then as I got pregnant the second time and I was looking to get pregnant, because once we were trying for him, I sort of thought, well, I started like researching things and then started picking up on certain Instagram accounts where I was like, oh, that rings true for me already, or this, that, and the other. I was like, oh, I hadn't thought about that. And so then I started to look into the sort of like the more complexities of it. So when I found out I was pregnant, I was very much in the trenches of it all and just trying to work it out as I went. And then I just realized actually how like there's so much to it, so much to women's health. So I'd never considered how I breathed in terms of my core management. I'd never considered pressure on my abdomen or my pelvic floor. I'd never thought about my pelvic floor because I didn't wet myself. I didn't think I had an issue or would ever have an issue. I was like, I don't have any problems there. I'm fine. And I assumed because I lifted heavy that every part of me would be strong. How can I not be strong? Because I can lift this X amount of weight and I can row for this distance in this time, or I can run this far, this fast, I can do this many pull-ups. So of course I'm a strong person. There can't be a weakness somewhere in there, because how would I be able to do all those things? And then, as I progressed through that, I started to realize that maybe I knew absolutely sweet FA about like that part of your anatomy, pelvic floor and your deep abdominals, your core system, how that all works. So that's how I then went on to do my Girls Gone Strong pre and postnatal coaching course. So like hadn't done that whilst I was pregnant. So I've done that postpartum, and then postpartum I've had lots of issues, from like low grade prolapse to diastasis recti. So my abdominal muscles are separated, they still are. And you're like, oh my God, I train separate. They say if you train, you're not going to get these things, la 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 la. And I did all these things that I thought I was supposed to do, and yet still here I was. What the fuck? Like, but then also I started seeing things in myself that, having coached other women, that I'd seen in them. and in men as well. So like my dad had major abdominal surgery years ago, and I think he's got diastasis recti as well, you know, like, and I started to see like these common sort of traits in people that I was suddenly seeing, and that, and then as I did my course and I started learning more and more about how abdominals work in the pelvic floor and how the pelvic floor and the diaphragm work together, that I was like, wow, this is like way far reaching, you know. And then as you started to introduce like internal talk and stuff, and then you're talking about deep abdominals, and that really relates really well into sort of like a lot of what I've learned as well. And I started to be like, this is actually huge, actually. I think this is a missing piece in a puzzle for so many people. So, you know, for a lot of women, pregnancy is the straw that breaks the camel's back with these things, with these issues. This is where they're going to come to the surface because you put so much pressure on that system in that short space of time. And then you go through a very traumatic event, which is childbirth, whether it's a cesarean or a vaginal delivery, you go through that. And if you've been managing that system poorly for however many years before, then you are not going to fare well when you go through that massive trauma. It's just like if you didn't move a bicep well, you know, and then you tore it, and then you were trying to rehab that but still moving it poorly, you're going to struggle to rehab it. Whereas the person who moves it really well, and then they do, you know, go through a trauma for whatever reason, theirs is obviously going to rehab better because they're moving it well. And it's the same for your core and your pelvic floor and pregnancy and all these things. That is the trauma, but sometimes there's some of these underlying things that actually you could be doing better, that would like change not only the way you move and feel, but like your long-term health. So like, you know, back pain and all these other things, and also preserving your pelvic floor, which is really important. You know, like when you get older, especially for women, when you hit that menopause, you really want to have like done something to look after that, because as soon as your hormone levels change, that can suddenly become an issue. And with a lot of these things, they're not an issue until they are. It doesn't mean, it's not just because you're not experiencing something now with it, doesn't mean that there's not a problem there, you know. And so that really, like, the more I've gone into it, it's just fascinating, actually.
I think it's similar to like, it's similar to the diet. If you eat a meal that's really sort of if you eat a meal today that's laden with like industrial seed oils that cause inflammation, you're not going to get cancer tomorrow.
No.
You're not going to get chronically ill tomorrow. But if you eat that every day for 30 years, guess what? You're going to get chronically sick. So it's the same thing, isn't it? I think if you're neglecting something it's something that doesn't just happen overnight.
No.
And I think as well, like you've said it a couple of times, but I think it's important to point out that having a baby is a very, it's a traumatic, it's a really big deal, isn't it? Like,
pregnancy and postpartum is a traumatic life event.
It's
physically.
Your body's going through a car crash basically, and you can't just expect to if you know it's coming, which obviously you do, you should be preparing yourself as best you can for it, and you shouldn't expect just to be able to sort of bounce back the day after and be back in the gym doing the same things you were doing before.
Exactly not. And you have to also remember that a lot of the people who do really well, like if you look at Cara Saunders, who trained, I don't particularly agree with how she trained when she was pregnant, and I don't agree with a lot of her postpartum recovery, but she's been lucky and she's had a massive team around her. But she gets glamorized, you know, she's the one that gets reposted on Instagram. She's the one that like CrossFit are like, oh, look, you can do this, you can get back to the CrossFit Games in 9 months. Whereas you've got the other ones who fall a bit by the wayside, like your Lindsay Venezuela's, or your, I mean, Annie's getting a little bit of coverage, who struggle, and they just get dropped. They get dropped by their sponsors, they get dropped by everything. And that message that like that you don't have to bounce back. It's just like, oh, you're shit, done, off you go. Look at Cara, she was still fucking overhead squatting what she could do pre-pregnancy. What a boss, you know. You're like, well, that's not really the true story for most people. She's again, probably the anomaly. you know,
and that comes back to sort of priorities again, doesn't it? Like, you know, should we be prioritizing that over kind of health, you know, like beating yourself to, like, again, trying to sort of claw yourself back to, I think it's important to really make it clear that, which is something I think we all struggle with, is the fact that we're not the same person today we were yesterday.
No.
And it's a very kind of, it's a very human trait to especially, I mean, you see it a lot. It's, you know, I once did an Ironman, or I used to be able to squat this, or I once did this. So so we're almost always trying to, we reach a height at some point, and then we're always trying to, if we tail off from there, we're always comparing ourselves to that person who we're not anymore, who did this. And I think that's quite a common thing. Again,
I struggle with it.
Well, yeah, so do I, massively. So we'll probably talk about this another day, but I think it is a very human thing to kind of, we're all, you know, we're trying not to get old, aren't we? Basically, we're trying
pretty much, yeah.
Yeah. So with that big traumatic thing of giving birth and having a baby, you can't expect to, like, you're a different person now.
Definitely, you are changed,
and you've really got to kind of embrace that. Obviously, I'm not talking from experience, but you know,
but you are changed. So it's like you're not. I mean, and with each subsequent pregnancy, you change as well. So, you know, like I think I'd underestimated second time round. Sort of like, I just thought if I trained through pregnancy, that like give me 3 to 6. I thought, if I do 3 to 6 months of core pelvic floor rehab, I'll be fine. I'll be good to go. But most people just skip out that phase altogether, actually, and just go straight back into what they were doing. And some people would be okay with that, but a lot of things have become like, they're common and we make them out to be normal, but they're not normal. So like, you know, leaking when you jump, or like, you know, like back pain, or like pain in your like C-section scars or things like that, or tightness, or struggling to get your core to work. We sort of like accept and mum pooches, those kind of things. We just like accept it as a side effect of motherhood, whereas actually there is quite a lot we could do. It's just that I feel like especially the fitness industry is very aimed at making women train like we're small men, rather than training like we're women, and actually accepting that maybe we have slightly different needs, and different, and like you say, at different seasons in your life you're going to have different needs. And it's so tempting just to, like, I knew that like when I was like 4 weeks after having Rory, it was the open and there was a workout, and I think it was cleans and burpees, and I was like, I could have done it. And I know if I'd have done it, it'd have been one of those things like, wow, look at Emma, she's like a month after giving birth, she's done this, you know. And I'd probably got a lot of kudos for it, whereas I got 0 kudos for the fact that I was doing heel slides and glute bridges for 3 months. You know, nobody congratulates that. And I think that is a really hard thing, especially when you're going through pregnancy and postpartum, is that nobody celebrates the person being sensible at the back of the class, taking their time, drinking their water, modifying every movement. No one's like, oh, aren't you badass? They're like, but if you'd gone and done something where you'd be like, yeah, I'm just going to move this heavy barbell, I'm going to do it, everyone would be like, oh, aren't you awesome? And it's like, but no one's then considering the fact that that person who's doing those things might be having a load of issues, but because they keep getting this external validation, that they're like, I'm going to keep doing it. And it's like, and there is a lot of that, I think, with pregnancy, that it's like, oh wow, yeah, I was really into that message, like no days off, keep going, keep pushing, you know, pump the bump, let's go, let's train for birth. But then as I was researching it as I went, I was like, it's not really the best strategy. But I did really struggle with that. Like my brain really wanted me to keep pushing hard. There's like this woman, postpartum athlete and coach, Brianna Battles, and she talks about the athlete brain when you're like pregnant and postpartum, and it's where your brain's telling you that you really want to keep like pushing, and when you're used to pushing through pain and all those signals telling you to stop, and that when you're pregnant is really hard to shut up, especially when you've got to a certain level. And then it's trying to like balance that out to then actually like consider your core and your pelvic floor. And things that I was really guilty of when I was pregnant is I'd be like, this weight's not heavy for me, but then I'd never really considered the fact that it was really heavy for my pelvic floor and really heavy for my abs, which were, you know, like under a serious amount of pressure. And so okay, my structure somewhere can allow for me to move that kind of weight, but actually there's 2 parts of my body there that are extremely under pressure, just because for no reason, they just are, and I'm gonna piss them off by doing an 85 kilo deadlift. You know, because that's half of what I can do. You know, I'm like, oh, I'm working well within my threshold here. All right, a little bit more than half, but
right, if you're at the limit for those individual pieces, then that's when the wheels are going to come off, isn't it?
It is. And so it is hard to know where to like put all that in. And then I mean, the other world that then got opened up to me is how you breathe. I had never considered how I breathe would be so important, but for pregnant and postpartum athlete, breath is everything. I'd argue it is actually for humans.
Yeah.
That every person who's a person should be thinking about how they breathe when they exercise, because if you want to have a baby, or it will help afterwards. But also, every person who's a person should be doing it, because actually it will make your body move as it's supposed to move.
Yeah.
And your muscles to fire, and for you to get tension in places that you want tension in the right way, if you breathe differently, because like the diaphragm and the pelvic floor work together. So like when you breathe in, everything comes down, and as you exhale, your diaphragm comes up, but your pelvic floor comes up with it, so you get that support as you exhale. So like moving when you're pregnant, allowing yourself, and postpartum, allowing that breath really does change how your pelvic floor will respond, and that mind muscle connection. But even when you're not pregnant, and even if you're male and have no desire to get pregnant, that still is true. Like that movement, because it's all connected and your pelvic floor is connected to your core, when you do that exhale, you're like deep abdominals, those ones we talk about on internal talk, you know, they start firing. And it's a very subtle thing. You don't really, it's not like let's go rock hard. It is a very subtle sort of firing, but it does work. But obviously when you have a baby living on your pelvic floor, it's quite hard to do that. You know, that's it's under huge pressure. So properly engaging your abs becomes quite difficult, because they're moving out, you know.
Yeah.
It's supporting something else.
If you've got really dysfunctional breathing mechanics and you're just chest breathing all the time, and
that was me. And Valsalva, I'm a serial Valsalva, you know, holding my breath till the veins pop. It's so bad for you.
Yeah, not cool.
Or there are ways of doing it, but it shouldn't be your only strategy.
No, it shouldn't be your default setting, should it?
No, it should be, like we say, when you're doing between training and testing, arguably when you're training, you probably shouldn't be using Valsalva that often. You should be breathing through your movements.
Yeah.
You know.
Yeah, totally.
Definitely, you know, like, because that is how you're going to get the right muscles firing at the right points in time.
Yeah.
Which I think is really important.
Of course it is. So let's talk about specifics then. So
okay.
Let's talk pregnancy. So
yeah,
pre-birth, how should ladies be training? How should they be approaching the training? And how should we be scaling? I know, obviously, without going into specific sort of listing every movement out there, but how should we be scaling? And how does that change through from like day 1 to month 9?
So I think it's important to say before you start on this is that, like, all the research, it's quite limited, because I think ethics on training and pregnancy and how you push a pregnant woman exercise wise, it's quite hard to actually like work out how you're going to do that. And it's also important to note that exercise just means a structured form of movement. So like there may be research that exercise is good, but that exercise isn't necessarily weightlifting or running or whatever. It could be, you know, and resistance training isn't necessarily, I'm going to pick up a heavy barbell. That could be doing air squats, because that is also classed as resistance training. So I think it's important to note that, like, a lot of the research is constantly changing, you know, as they gain more data, as more women go through pregnancy training and all these kind of things, that it is an ever-changing kind of beast at the minute. It's very much in its infancy. So anything I say is subject to change. But I suppose if you're going to look at it, so from like, you want to, because you have your 3 trimesters, your first, second, and third, and things want to look quite different between the 3. So first trimester, physically you won't see particularly any changes. You might with subsequent pregnancies towards like the later end of it, but generally a woman will look pretty much how she always does, and at this point be quite secretive usually about being pregnant. But this is the time where there is a heck of a lot going on under the bonnet, as it were, changes wise. Your hormones are like, whoa, there's so many hormonal changes going on. One that's really important when you're to consider when exercising is relaxing. So that is like the hormone that starts to relax all your joints and muscles so that you can, like, because your hips have to move out to make space for that baby. So, but it affects all your joints. So you're already quite susceptible to injury. from that. But also in that first trimester, you are probably going to be hit with extreme fatigue, nausea, weird changes, taste in your mouth, your blood pressure might change, so you might be experiencing lightheadedness. So all these things you need to consider when you're making exercise choices, because yes, in your first trimester, you could say, I can totally do everything I did before because physically I look the same, but you're not. So like, first of all, you need to seriously honor your energy levels because they are going to be down. I think, so you're probably going to have to, for a lot of women, give yourself grace to reduce the amount of days a week that you train, or you might go for a walk, or it might look completely different. If you're experiencing things like nausea and you're actually being sick, it can be almost impossible to exercise. And then there's also this fear, because there's been a lot of to and fro with data about where your heart rate goes, and risk of miscarriage. There's no evidence to show that wherever your heart rate goes has any effect on that. But like personally, I could not at that point go to any kind of high intensity, otherwise I'd have just been throwing up across the gym. And I don't really think it's necessarily the time to be pushing yourself to those high intensities, because your body is going through so much that it doesn't need to be recovering from that kind of excessive push. So I would say, in terms of intensity, first trimester, think about how much, go with the talk test all the way through pregnancy. I'd say go with the talk test. How much can you say? You shouldn't be getting yourself to that point where you can only give like 1 or 2 word answers, really. You want to be keeping slightly below that, so that if a coach came over to you and said, are you all right? You could be like, yeah, I'm all right, thanks. And you can regulate that yourself. So even if you don't want to tell people, you can just choose not to push that hard. And that would just, you don't want to be pushing yourself into a position where you're struggling to recover. And then again, you might want to start making reductions in the amount you lift. So definitely don't be moving any weights that you need to hold your breath to move. You should be able to breathe throughout a movement. And then also I would recommend not particularly going up onto things like rigs, because if you are experiencing dizziness, you don't want to be suddenly getting dizzy when you're holding onto a rig, because you might fall off it, And while, okay, you can do these things, none of the research really figures into the fact that people will be doing things like CrossFit where you're getting up at a height, and you could experience some level of dizziness and fall off there, and that could be, the likelihood is that you'd be fine, but that would be quite a traumatic experience for you, because you'd be like, oh, what do I do? Have I damaged myself? And so I think it's just about being sensible in that first trimester and really honoring your energy levels. So like, if you need to rest, you rest, take more rest, reduce that load down, and just give yourself some serious grace, because your body is going through a lot. You don't feel rubbish for no reason.
Like, you've only got you've got finite resources, haven't you, we all have, for repair and recovery and all that kind of stuff. If you're growing a human inside you at the same time, like, I'm not a doctor, but I would assume that takes up quite a lot of resources.
It does. And at that point, the baby's not using the placenta. They're pretty much like living off you like some sort of parasitic being, as it were. So like, you really are like, you are really struggling, and that is when all the most important things are happening for baby. All the organs and stuff are starting to develop. So you're growing a human from a sperm and an egg to an actual like living little person. It's pretty huge what goes on in that first trimester. So I think that one is really about being, more than anything, being kind to yourself. But it will vary. From some women feel great, and if you do and you feel fine, you're probably okay to carry on doing things. But do start making, just noticing things, noticing how you're feeling, and really checking in with yourself. And don't just think, I did this before, so I'm going to carry on doing this. It's not the time to be doing it. It's now time to start thinking about what your goal really should just be about maintaining some, your muscle sort of like mass, if it were, and maintaining some cardiovascular fitness and your mobility, trying to maintain that as much as possible, but not about ever improving it during pregnancy. And so you need to be,
like you said, you've got to be careful with relaxing. You've got to be, mobility work's got to be you've got to be doing everything very carefully.
You do.
Active stuff versus just doing passive stretching is
I made that mistake.
Yeah.
I'm like, oh, you split myself in two. Horrible. Don't do it.
Yeah. No.
So your first trimester generally, well, that's when generally people won't tell you that they're pregnant. So I mean, you do have to go off field, but really do watch out for things. So for me, I started to notice that, like, as you go through your pregnancy, you have to look out in your abdomen for doming or coning. This is like where your abs will like stick out. So this is a sign that you're not managing your intra-abdominal pressure.
Yeah.
And you don't want to be putting outward pressure on the midline. So for me, I actually started noticing that in my first trimester, second time round. So I couldn't do pull-ups from about 10 weeks, maybe even a bit earlier. I mean, I felt sick actually. So I mean, holding onto the bar was like just disgraceful. But like, I would just wish I'd just gone to ring rows from the moment I found out I was pregnant, really, because I don't know what I gained from those extra 4 weeks of doing pull-ups.
No.
And I might have caused myself some damage, and it was just miserable, really, because my body didn't feel good. I couldn't do as many as I did. It was disheartening. So I wish I'd personally, in the first trimester, just gone straight to ring rows.
Yeah.
But I did from about 10 weeks because I just could not manage my core pressure. However, I would probably argue that I didn't manage my core pressure well before I was pregnant, but I didn't look for it then.
Oh, you didn't, yeah, and you weren't aware necessarily.
No. So that would be like the first trimester. So first trimester, just to summarize, I would reduce intensity, increase rest days, really listen to your body, talk test, make sure you can articulate a short sentence or point, reduce load, do not hold your breath, don't go upside down, and probably avoid things like heights, overstretching, all these things. And then going into your second trimester, so this typically is actually where women start to feel a little bit better. So the pelvic, not the pelvic floor, the placenta starts to take over. A lot of the morning sickness starts to end, and a lot of women experience a lot more energy in the second trimester. You're not huge at this point either, so you're not majorly uncomfortable. But that's not true for everybody. So as you're moving into that one, some women might find it easier to push through certain things or return to doing things they were doing pre-pregnancy. But this is the point where you really need to start like sort of thinking about, you know, core connection. So you want to be thinking about mind muscle connection with your breath. So the connection breath is how you breathe, where you exhale through exertion to make sure your pelvic floor is working with you. So you want to be starting to focus on that, and you want to be starting to just move and start changing the movements you do. So for example, barbell work that's going to come past your bump, really I wouldn't do that at all. So if you're an Olympic lifter, you move to dumbbell and kettlebell variations, and you start moving to probably doing more accessory work just to maintain some of that strength and that mobility that you've got. But you need to like knock that on the head. You don't need to be doing barbell when you're pregnant, because you can knock your bump for a start when you're coming past it, but also bar path will be crap, and it's not effective. But in terms of Olympic lifts, they need to, I would not do them.
If anything, you're just going to set yourself back. You're going to start developing bad habits that you probably didn't have before, and actually just end up setting yourself backwards.
Dumbbells and kettlebells are your friend at this point. Now I started moving most movements over, other than a deadlift, but again, you're going to have to start in your second trimester, start thinking about how you pick things up. So obviously now you're going to start having a bump in the way. So like, for example, I did sumo deadlifts rather than conventional deadlifts because my arms simply could not go round my bump in the same way, and it just allowed for that little bit more room. But some women will find that painful because some people, it can cause pain, you know, like on the pelvic girdle, as it were, and it can, like a splitting pain, like jabs down your vagina almost. So some women just can't do that. So then it is about moving to more kettlebell variations, like a kettlebell single arm Romanian deadlift, or you know, all these other things, or farmers carries. So I would really then start to be moving exercises all over to kettlebell variations, to lighter loaded carries. So like a farmer's carry is a great one. Things like ring rows. Stop traditional sort of ab work. So planks, no. Ab mat sit-ups, a definite no. And start doing things more like side planks. Start working on glute strength rather than focusing on core strength. So like elevated glute bridges, monster walks, all these kind of things are much better for core work. You know, you can do like static marches rather than doing V-sits or hanging leg raises. I wouldn't be doing those anymore, because that hang position off the bar then starts to create an awful lot of intra-abdominal pressure, which can lead to issues with separation of the abs. you know, and really just start making sensible choices. And as you progress through the second trimester, things will have to change. So for example, at the start of your second trimester, doing a dumbbell snatch from the floor, you'll probably be okay. But then as your bump gets bigger, you might want to move to either putting that weight on a platform, like a weight plate, or you might want to start going to the hang, you know. And then you have to start being mindful of your posture. So you always want to make sure that your ribs are stacked over your hips, because once you move out, and this can be pretty hard when you're pregnant because the baby can shift you to the point where you actually can't really do it. Again, then you'll have to make further considerations, but you want those things to be stacked so that your pelvic floor can work as it's supposed to be, and that you're not putting excessive pressure elsewhere where it doesn't need to be. So for some people, going overhead becomes impossible because you can't do it without arching backwards. So you're gonna, as you progress through that trimester, you'll probably feel quite good, but you will have to change exercises. So for example, if it was a WOD, with burpees as well, so you don't want to be lying on your belly, so you want to be going to like elevated burpees, elevated press ups, you know, elevating everything, because that plank position really puts a lot of pressure on your core. You're okay on all fours, but not on your feet. So anything in a quadruped position you can do. So like bird dogs, those kind of things are great, but a plank is like a big no type thing. So, and press ups are a no, but you can do those against a box or a wall and start just moving things off. And as you get bigger and bigger, you just want to, you know, scale it further and further back, and you'll start to find that you lose movements. So like start of your second trimester, you'll be able to do a variation of most movements, and your list will get shorter and shorter as you go through, you know, and as you get to the end, there'll be a lot less that you can do. And then as you're coming into your third trimester, it's kind of like a continuation. So talk test again on these. You really don't want to be going to a point where you've got a 1 or 2 word answer. You really want to be keeping, again, if a coach comes to talk to you, you should be able to tell them how you're feeling in a sentence.
Yeah.
And that's what you should be keeping in your mind.
So just on that, the sort of our classes, or if you go into any kind of, you know, doing high intensity sort of 5 rounds for time type stuff, I think a good
change to an AMRAP.
Yeah, or just basically just keep moving through it.
Yeah.
You forget about the clock, forget about how many rounds you're doing. You're just going to do the same movements, but like you said about being keeping your ribs stacked and being, you've got to be mindful. If you're going anywhere, obviously there's the issues with going intense anyway that we've talked about, but you can't be mindful of what your pelvis and your hips and your ribs are doing. If you're breathing out of your ears, can you?
No, so intention first, intensity later.
Yeah, so you can still do the same, you know, the same movement, like obviously scaled. You can do the same movements for the same length of time, but you're gonna just move through them with a moderate intensity where you can keep aware of what's going on and move well, and obviously you're not ramping your heart rate through the ceiling, and you might get through 4 rounds, and you just use somebody as, you know, once they've finished, I'm stopping, or, you know, once everyone's done in the class, I'll stop, and you move the same amount of time. And that's one way, without having to sort of write your own workouts and worry about, you know, loads and loads of sort of overcomplicating things. You're just going to do some work for the same length of time as everyone else, but just take the intensity down and just focus on moving well. I think that's...
And keep drinking as well, because you get dehydrated. You're hydrating for 2, you've got a bigger blood volume, and like the angle of your like lungs changes, things like that. It does actually become, hormonally and physically, it becomes harder to take on as much oxygen and to breathe in the same way. You don't want to be doing that. You want to be keeping more of a sort of like nice connected breath than like having your rib cage like working hard, your intercostals pulling you in and out if you can help it. So and that is a good point. Or like move to an AMRAP, or like, you know, if there's like a 400-meter run, just do like a 2-minute like gentle cycle or something instead. You know, I don't personally recommend running when you're pregnant. I think there's so many other things you can do, and skipping. It puts a lot of pressure on your pelvic floor. I know people do run when they're pregnant. Like I know Jess Ennis puts out articles about running when you're pregnant, but I'd argue she's a very good runner. She's not just your 400 meter in a CrossFit WOD occasion runner.
Yeah.
And she had a team of physios behind her.
Yeah.
And if you don't have that, how are you going to know? She knew what she was doing more, but she was probably getting regular sort of pelvic floor examinations throughout her pregnancy to see how she was doing.
Yeah.
But even she massively reduced the intensity when she did run. But personally, from like what we do in the gym kind of perspective, I would get on the bike.
It's a risk versus reward thing, isn't it? Like,
yeah,
you don't obviously, you just don't want to be doing things that are, you don't want to be taking risks, do you?
No, and it's a really short period of time when you look at the bigger picture. It feels like forever when you're in it, but in the bigger picture, it is just a minute, like drop in the ocean of time, and it's over before you know it. And then, then when you're going to like progress into your final trimester, you're getting pretty big by this point and uncomfortable. And people get celebrated for work. Like personally, I was in 2 days before I gave birth, still training. But that doesn't need to be the goal. Like, so as you get into your 3rd trimester, you want to be sort of thinking about learning to relax your pelvic floor. And yes, you can still keep moving. And the goal should more be to just keep moving in whatever way feels good. So like, that might be going for a walk some days. That might be, just doing a gentle sort of like static bike, thing, or it might be doing a really gentle WOD. It might be doing some yoga rather than doing a WOD, or it might be doing a WOD, but again, working within intensity. And you'll find that the range of things that you can do by this point, your list of exercises that still feel good will be a lot smaller than it was at the start of your 2nd trimester.
Yeah.
And so, and it is just now about honoring that little bit of time you have before baby arrives, trying to really like try and keep like your mobility and stuff. Try to think about like, doing like nice deep sort of squats and stuff if you can, like holding on to rings, those kind of things, and be more like flowy with it, like you really like come in to a season of your life where it's hard. That last trimester is hard, it's miserable. For me, I felt better when I came to the gym and I did a workout, and I'd just do the class, and I would change pretty much everything, but within reason, like so I think one of the ones I did, there was a WOD where it was going really hard on the assault bike, and so I just poddled on the assault bike for that amount of time. It was on the row machine, I went on the assault bike and I just did a slow steady workout in that time. And just taking it easy. I did a lot of like workouts where I just be like, I'm going to put a 20-minute clock on and I'm going to do this many movements for 20 minutes. I'm going to do it quite light, and I'm just going to, and then at the end of the 20 minutes I'm done, and that's me done, and I've done something. And the same rules apply as in your 2nd trimester really, but you'll find that it's just more reduced what you can do, and you really want to start thinking about learning to relax that pelvic floor, ready to go to give birth really, and give yourself a bit of time because your life's about to be turned upside down. So for me, I wanted to come to the gym because I knew that it might be the last time in about 5 years that I got the time to come at lunchtime. So like I thought, well, I'm going to come, and I'm going to come to the gym and I'm going to do that workout, and then I'm going to go home and have my lunch quietly in a bubble bath, and I might not do that again for a fair few years. So that was for me, but it is really honoring how you feel on that day. So if you wake up and you're not feeling it, even if you plan to do it, don't do it. Do something else.
That's just something we like. Again, we talk for another day, but that's something that we're not very good at, are we? Like,
no.
This is what's programmed. I've got to do this, or I said I was going to do this today. I feel terrible, but that's what I'm going to do. So like I think the main takeaway that you've mentioned a lot is listening to your body, which again we talk about a lot, and
we do.
For everybody, it's something that we're not very good at generally.
No.
So so baby's here.
He is. I might have to leave this bit for another day because he's just come back with grandma. Yeah.
That's quite apt.
Yeah, it is. He's here. Okay. So we might have to save the postpartum bit for another day.
Yeah.